Now, in acute hemorrhage, someone can lose a lot of blood really quite quickly, and that can result in effects such as tachycardia, peripheral vasoconstriction, cold peripheries, even a drop in blood pressure. But in chronic hemorrhage, very often less blood is lost, but over a longer period of time. It's like a dribbling hemorrhage, if you like. The patient might be losing a little bit of blood every day, but it's enough to build up. Because if the patient's losing more blood than their bone marrow is making, then they're going to become progressively anemic. In anemia, there's a reduced amount of hemoglobin in the blood. And also, the way I define anemia is that anemia is a reduced oxygen carrying capacity of the blood. And that can have short-term effects and long-term effects. So the patient might start to look a little pale. When you test the blood, the hemoglobin's going to be low. And the symptoms are insidious. They tend to come on slowly and progressively. So the patient realises that maybe they don't feel quite as well this week as they did a few weeks ago. But it can take days, weeks, or even months for the patient to realise that they're getting ill. There's a general tiredness, because if there's not enough red cells, not enough hemoglobin, that means there's reduced amounts of oxygen going to the muscles, so the patient starts to feel tired. And there can be faintness and dizziness because of reduced amounts of blood being taken to the brain. And of course, the brain is a very oxygen-dependent organ. And if you look in the blood, as well as finding a reduced amount of hemoglobin, you can also find reticulocytes. Now, reticulocytes are young, immature red cells that still can contain some nuclear fragments. So you can see little blips of the little bits of the nucleus retained within the cytoplasm of the erythrocyte. And that indicates it is a young red blood cell. And it's also an indicator, if the reticulocytes are raised, that the bone marrow is trying to work harder to chuck out blood cells quicker to compensate for a chronic hemorrhage. So a reticulocytosis, increase in reticulocytes, can indicate that the bone marrow is working harder to try and compensate for some hemorrhage. And that means we need to use all our observational skills to try and work out where that hemorrhage is coming from. So chronic hemorrhage, progressive anemia, insidious onset, tiredness, faintness, dizziness, and the presence of increased numbers of reticulocytes in the blood.